Okay, we are transitioning into the wilderness side of first aid. As we're moving through this section, everything's going to be through the lens of wilderness. But as things come up, I'm going to go ahead and explain how that might be different in the front country where you have access to quick assistance from EMS. So let's go ahead and start with our initial assessment because that's one of the things that's different in how we do things with wilderness versus front country. So there's a pyramid here of how we work through our system. And we start at the top of the pyramid and we work our way down. So we're going to go through each of these, some of which we have covered before, some of which you will be hearing for the first time. And then for your assignment for this, there is no quiz. There's just a quick assignment on showing a initial assessment. So what does this look like? We start with our scene size up. We move through our A, B, C, D, E's, so our life threats, so we can prioritize. We do a head-to-toe assessment. We look at vital signs, and we ask about history. Then we move through problem list and come up with a plan, decide if there's going to be an intervention or treatment, and then we monitor. So what does the scene size up look like? This is the part that we have done before, okay? There's a couple additions to this because again, when you're in a wilderness setting, that means it's gonna take longer than an hour or longer to get help. And so you're gonna be required to do a little bit more. So throughout this section, I took some screenshots from the text that's uploaded in your module because I wanted to make sure that you had access to all of this. I'm going to highlight some of these main concepts here, but if you want to dive deeper into it, you'll have that digital version of the text for free on Canvas. So when you check the scene, we obviously want to establish the control of the emergency. We want to recognize that there is an emergency. We want to check to make sure that it's safe for us. These things are things we've talked about before, okay? So you're going to follow those standard precautions to prevent disease transmission. If the person is conscious, you're going to get consent. If the person is unconscious, we're talking about adults, right? If the person is unconscious, then consent is implied. We're going to check for cues of the mechanism of injury, the MOI, sorry about that, or the nature of the illness, some of which we'll be able to tell if the person's unconscious, just like we did earlier in the semester. We're going to move the person only if it's necessary, just like we talked about, okay? But again, we're looking at this through the lens of I might be needing to do something and have an intervention for an extended period of time. So just having an unconscious victim that is breathing and calling EMS is not going to be the end of this scenario. So then we proceed through our life threats or our ABCDEs. Okay, so A, if the person is unconscious, you're going to look through the airway, right? Because if the person is conscious and they're able to talk, then we'll be able to establish if their airway is open. Making sure that, just like we talked about earlier in the semester, that you tilt the chin, tilt the head, lift the chin, right? And make sure that the person is breathing. If not, you're going to proceed and look and move forward with compressions to try and get the person breathing. B, you're going to look, listen, and feel for movement. Normal breathing. You do this by putting your arms around the thorax or the chest of the person and to see if they're breathing. You can look and listen, right? So here's the really interesting thing is I will be posting a video of someone going through this entire assessment that you're going to replicate and show me that you have the competency in this, okay? After that, you will proceed to C, which is if the person has circulation. We know that if a person is not breathing, then they can't continue to have circulation. So that's why we check in this order, okay? If there's severe bleeding, then we want to stop the bleeding immediately. So if there's some sort of impact, so we're going to apply pressure to that wound. We'll get into wound care later on in this section, where we'll go into more details, but bleeding is a life-threatening disease, life-threatening issue, so you're going to stop and fix that. So at this point, anytime that you hit if there is a problem, you're going to stop and fix. You're not going to continue to B, C, D, or E. If the person is not breathing, you're going to stop and fix. If there is no circulation or the person has excessive bleeding, you're going to stop and fix before proceeding to the next. D, you're going to look for any disability resulting in damage to the spinal cord. Did the person fall at a greater distance than 5 feet? Does the person look like they hit their head on that impact? Did something fall and hit the person? Did they fall off a horse? Anything that looks like there could be any sort of trauma to the spinal cord, you're going to stop and fix, okay? E is assessing the environment and the exposure. So what you'll notice, the major difference here from the front country is that D, right? Is there an injury or a potential injury to the spinal cord? And then stop that movement, hold that in place. We're going to go over this in a lot more detail at a later section. Next, you'll move through a head-to-toe assessment. This is equal to vital signs and history. In fact, if you have 2 rescuers, which is the scenario that we'll be doing in the video that you have access to, a lot of times while you're doing the head-to-toe assessment, you are also taking vital signs and a patient history, okay? But we'll go ahead and start with the head-to-toe assessment. So, or as you can see, secondary focus assessment, because we already started with breathing, spinal cord, and airway circulation, okay? So what you're going to do is you're going to check the person from head to toe with your hands on. You're going to make sure that you're checking the head, make sure you don't see any bruising. If you do at any point there is tenderness or someone moves when you touch a spot, you need to expose that area and check to see if you see any sort of injuries or bruising or bleeding or anything that leads you to believe that there's an issue. You check the head, the face, into the ears, make sure there's no bleeding in the ears, behind the ears, check neck, chest, abdomen, pelvis, okay? And you're going to move all the way down through the legs, each back, and feet, okay? Look for dots, any deformity, open injuries, so punctures to the skin or some sort of open injury of the skin, any sort of tenderness or swelling. Then you're going to check for those circulations and sensations, or what we call the CSMs, at each extremity. In doing so, you'll see, again, all of this in the video that's posted on Canvas to actually watch this assessment take place. But the idea is making sure that we have circulation in each of our extremities. So you might check the radial pulse normally, but now you're going to want to check the pulse on the feet and make sure that the skin color and temperature and moisture is what to be expected given the circumstances of the environment. Next, we move into vital signs. Again, if you have 2 rescuers, which is the scenario that we're going to move forward with, someone else might be checking vital signs while the other person is doing a head-to-toe assessment. The vital signs that we're looking for as wilderness first aid is our respiratory rate, our heart rate, and skin color, temperature, and moisture. Okay, so respiratory rates are anywhere from 12 to 20. This is something that you want to check when the patient or the injured person is unaware that you're checking this. So low respiratory rate could be a sign of certain things, and high respiratory rate can be a sign of certain things. Having this documentation is important when EMS or rescue services arrive. These are the things that you will continue to check as well. Heart rate or pulse is the number of beats per minute. Healthy range is 60 to 100 beats per minute. Okay, so keeping track of that, making sure that there's nothing excessive, And then you also want to be checking, is it strong and regular? So what I mean by regular is the most heart rate, that, 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 that. Is it sporadic? Is there something that's an issue? Does anything seem odd? If the person is awake and conscious, feel free to ask them, do you have an irregular heartbeat? I'm noticing this. Is this something that's common or that you're aware of? Okay. Then you're checking the skin color, temperature, and moisture. Obviously, you probably won't have a thermometer, but basically you're figuring out, is the skin pink, warm, and dry to the touch? So we don't want excessive sweating or something like that. Okay. Your level of consciousness, your LOC, is A stands for alert. So if the person is alert, then they are going to be A plus something. Okay. So A, if they are alert. If they're not alert, then you're going to let responders know. No, they're not alert, but they V are responsive to verbal stimuli. When I yell at them, I can see a response from the patient. Pain response would be a P, okay? So we react to pain even when we're unconscious. So if I was to poke someone with a pin, and even if they're unconscious, they will likely still react to that poke. Okay. U is unresponsive to any stimuli. So I'm yelling at them, I'm poking them, I'm tapping their shoulders. They are completely unresponsive. So they would be U plus O times 4, U plus O times 3, or V plus O times 2. Okay. So times 4 means that the person is awake, that they know their name, they know their current location, and they know what day it is and what happened. Okay? Times 3 is going to be who they are, where they are, and when time, but they don't remember the actual issue. So, for example, if someone falls off of the horse while you're packing in the Sierra, they know who they are, they know where they are, they know what time of year it is, what day it is, but they don't actually remember the injury itself. Okay? And times 1, or I'm sorry, times 2, they know who they are and where, but they don't know when it is. And times 1 means they only know who they are. So being able to address and identify those. Then you're going to take your history, and that's where you're going to ask the questions sample. Okay? So, sample, S is signs and symptoms. So, what are the signs and symptoms that the person is reporting? A, do you have any allergies? Is there an allergic reaction? Do you have any allergies to medications that I should be aware of? Do you have any allergies to foods that I should be aware of? Are you on any medications, over the counter or prescriptions? And if you don't know that medication, what is it for? Okay. When was the last time you took it? Anything to that effect. P, pertinent past medical history. What happened before? And is this a general issue that you need to be aware of? Are you pregnant? Is there anything that the patient feels like they need to express to the rescuer? L, last intake and output. When was the last time you ate, drank, how much? Are you cold, hungry, exhausted? Okay. E, events leading up to the injury or illness. I recommend that you download the Knowles SOAP, SOAP app. In fact, I recommend that you use that app for your assignment for this section, as this will take you through all of these questions to make sure you don't forget anything. Most of us have our phones on us in the back country anyways, so there's no reason you can't be documenting this stuff on your app. Okay, sure, you want to know this stuff by heart, but it's important to have that check and balance system to remind you to check. Okay, problem list, this is where you put together what we call a SOAP note, and you actually list out the problem list and the plan moving forward. You won't know any of this stuff until we continue on to future sections where we're going to talk about illnesses, injuries in specifics, and what the plan is and whether or not to evac or not. Okay. Interventions/treatments in order to move through that, and then monitor, making sure that you are checking vital signs until rescuers arrive. It's important to note that this entire pyramid happens with every patient that you work with in the backcountry. It's a head to toe assessment, vital signs, and history. You don't know what happens, you don't know the person's history. If they seem fine and they're awake and alert times 4 and everything is fine, it doesn't seem like a big deal. But then all of a sudden the person becomes unconscious. You've missed your opportunity to get this information. Okay? If you didn't do a head to toe assessment, they're complaining about the main pain that they're having, the broken ankle. But what we've missed is this potential spinal cord injury because we didn't do our head to toe assessment. So make sure that that this is the most important thing, so you're getting all the information for potential rescuers.